Guys, what are we down here? Fit Pro Health Clinics again, 109 Princess Street, Palmerston North. Now, last night I watched this program, I think it was on Channel 1, about, I can't remember exactly what the title was, medicines that are killing us, or could your medicines be killing you, or something like that. Anyway, TV1 it was on, to check that out. What was yesterday? 3rd of October. You should have a look at what that's on about. It's actually really interesting. It talks about, did two case studies. One with this lady had real bad, what was he on? Migraine? No, that was the guy. The guy had real bad migraine type headache stuff. He's taking amitriptyline, he's on some codeine, he's on some morphine, he's on quite a few different pain relief type drugs. He's had a headache for like 3 years straight, he said, every day. And the drugs were just kind of taking the edge off a little bit. So basically through this program they went through some different stuff around making other changes to the lifestyle. For example, his one was they got him doing a few more, changing his food up, so changing nutrition to eat better, eat a lot cleaner, so he's eating real foods, good meat, good vegetables, basically cutting out a lot of processed foods. And other thing he did was introduce more exercise, so it was getting involved in that. Now they watched him for over 12 weeks, and by the end of it, pain had kind of reduced as well. The other thing they found out with him was he had some problems with his jaw, and just the pain in here, and that was from clenching teeth, and he had some kind of stuff going on in there, tight muscles around his jaw area, so they went through physio and did some stuff there as well. So at the end of the 12 weeks he was obviously feeling a lot better. And there's another case study on there, I can't remember exactly who one was, but the thing that they did with, dermatitis, chronic dermatitis on her hands. So she had this stuff on her hands for ages, and she was wondering what was up with that. She'd been to lots of different dermatologists, specialists, you name it, and tried lots of different things, creams, steroid creams, whatever. So many other different things she had tried, even to the point of methotrexate, which is a chemotherapy drug, normally used in cancer. Immune suppressant, so it basically depresses the immune system. Anyway, she tried all that stuff, hadn't helped. Then looked at doing a cleaner diet, so she's actually vegetarian, so they looked at giving her some vitamin B12. They actually suggested that she start eating meat, but she wasn't going to do that, so they need to give her some vitamin B12 and a couple of other things. She was saying fish oil and some other supplements, but then the fact that she changed her eating, so she got rid of a lot of the carb stuff she was eating, so no sugar was hers. And they did that for about 12 weeks, and the hands cleared up. And so it kind of goes to show there's a lot of merit to be had in making lifestyle changes, and particularly around food and movement. So anyway, just thought I'd chuck that in there. A really interesting program, and really just, I think that's the way that people are going at the moment. They're getting away from that whole Western model of here's some medicine to treat your symptoms and manage your symptoms. People are sick of that. Okay, so people want to know exactly what they can do to treat the root cause, or the actual cause of these symptoms. So that's kind of what we're going to be getting into as well. Meds. Now, beta blockers, as you remember, I was going to explain in the blood pressure little equation that we had. It was your blood pressure depends on 3 factors. It's your heart rate, how quickly your heart is beating, the stroke volume, how much blood is being pumped out at each beat of the heart, and what's the resistance like in the tubing or in the circulation system. So how resistant is it to the blood being pushed through it. So those 3 factors will give you the blood pressure, which is ranged 120/80 type thing we always hear about. Okay. Beta blockers, how do they work? They treat symptoms. Basically they help to reduce the blood pressure. And how do they do that? They act on the 2 parts in that formula, the stroke volume. Now they do that by acting on receptors in the heart, so that the drug binds to some receptors in the heart and prevents it from beating as hard as it normally would, and it also reduces the heart rate, so how quickly the heart is beating. So beta blockers work by reducing the heart rate, and also by reducing the force of contraction, which would affect the amount of blood that's being pumped out each time, so stroke volume. So it affects, in that equation, it affects your heart rate and it affects your stroke volume. Okay, those are the two ways that beta blockers work to reduce blood pressure. Now, beta blockers can be used for anything from migraine headaches. There's low dose 10 milligram type stuff, propranolol, normally used for migraine headaches. It's even used in anxiety for people when public speaking type thing, or if they're anxious, nervous about something. Sometimes beta blockers are prescribed to help settle you down, calm you down. The way it does it obviously is by reducing your heart rate. Okay, so that's how that works. What else was there about? Oh, I wanted to introduce a new term to you today. It's called the NNT, number needed to treat. Now, what that means is, in a lot of studies that have been done, they have this number which is the amount of people that need to be treated to prevent whatever the bad outcome that this drug is supposed to prevent. Okay, so number needed to treat. NNT. You can Google it, have a look, and you'll find out a little bit more about it. Now, there's been lots of studies done, lots of things, kind of studies of lots of studies, meta-analysis and all the rest of that kind of thing. Basically, NNT, I was just looking at something before, for a beta blocker, if you're using a beta blocker, one of those medicines we talked about, if you're using a beta blocker to prevent heart failure, which is what it's used in some circumstances, the NNT for that is 165. So what does that mean? It means that in order to get or to prevent one incident of heart failure, we need to treat 165 people. And that was at 5 years. So when they look at the studies and go, okay, 5 years down the track, after being on this medicine and this group of people, we need to have treated 165 of them to have prevented one additional bad outcome. Okay, so I hope that makes sense. And it's kind of weird when you think about it, going, well, what about 164 other people that are still taking it and have been for 5 years? You know, what's happening there? Is it doing anything? And that's the question that's been asked a lot more recently. Are my medicines doing anything? Okay, so NNT is a really important number. So I'm going to be finding out the NNTs for lots of these things. Now, it's different for each situation as well. So, for example, that was a beta blocker in heart failure specifically, so to prevent an incident of heart failure in those patients that were taking it for heart failure, we need to treat 165 people to prevent one bad outcome, to prevent one heart failure incident, right? Beta blockers are used for so many different things, so the NNT, or the number needed to treat, would probably be different for each of those different situations. So it's about finding out what that is. You can you've got to go to some reputable websites and have a look. The one I was looking at this morning was the Centre for Evidence-Based Medicine. What else is there? So that's kind of a little bit of a spiel about those beta blockers for today. Didn't want to go on too long about it, but just if you're taking a beta blocker, remember it's the olols. Remember, have a look at that ingredient name, not the brand name or the trade name. The olols. Okay, so metoprolol, propranolol, sotalol, nadolol, pindolol, all the lols, beta blockers. Okay, and find out a little bit more about what you're actually taking it for, and then you can identify, okay, what are those symptoms that I'm being treated for. But anyway, that's all I wanted to cover today, was just let you know how do beta blockers work. So they work on that equation, on that blood pressure equation, by affecting the heart rate. They reduce the heart rate, and they reduce the stroke volume, reduce the force of contraction of the heart. So less blood is pumped out each time. So that's how it works. Sweet. Alright, I'm back on here tomorrow and I'll talk about something else to do with beta blockers, what kind of exercises you can do to reduce symptoms, just like how this medicine works. Alright, cool. See you guys then.